Market Johnny here with Evan Brand. Today, we are excited to talk about functional medicine approaches to address UTIs or urinary tract infections. My immune system just a little bit under the weather, so I will be channeling my inner Barry White today. Really excited for that, Evan. How are we doing, man?
Hey, pretty good. Yeah, hope you feel better and get back to kicking butt, which you're still kicking butt. Most people would call it in, but I'm glad that your brain is working enough and we're going to get this thing done.
I
So
haven't had a sick day in over a decade. I don't plan. I don't plan to have a sick day ever.
good, good, good. All right. So with UTIs, I mean, this is something that's extremely common. We see it a lot in young children because their poop gets into their urinary tract, whether they're wiping the wrong way or whether this is a young child that's still using diapers. So I've seen it with our children. We've worked on our kids. I've seen it a lot with the kids I work with clinically. And then, of course, in adults, we see this a lot where a lot of it is due to sexual transmission. I mean, we've seen many cases where if we support the female, the male is the vector, and the women start to get almost resentful towards their husband because they know every time they have sex they're going to end up with UTI. So then that really affects their sexual health and their relationship. And so today's podcast hopefully will encourage people to take this serious, and we'll have some strategies you can implement to get both you and your spouse, if that's what's happening, in better shape to where this is a non-issue.
Do we have any data on the semen quality affecting urinary tract infection in females?
I'm going to look it up, but I know clinically, and I know you've seen the same thing, that we'll hear that story all the time of where everything's fine and then boom, they have sex, and then all of a sudden they have a UTI.
Yeah, I know in men.
Here it
Like
is.
what?
So here's the study right here:
Yeah,
semen culture and the assessment of genitourinary tract infections. In the male, it says here is contributes approximately 50% of the cases.
yeah. I wouldn't be surprised. I wouldn't be surprised if nutrient deficiency has a lot to do with it because I know zinc is very high in semen, right? Very important for the health of the sperm, and I know zinc also has some antibacterial, antiviral qualities to it. So I wouldn't be surprised if someone's more nutritionally deficient. They're going to have less zinc in the semen, and that less zinc will make it harder, or make it easier for bacteria and other critters to grow. So just a thought. Again, we try to, high level thinking. What's the mechanism? Look at all the downstream signals. That could be one component, though.
Yeah, it's talking about these different types of bacteria in this male study, talking about how it plays a role in genital tract infections, and some of these are natural inhabitants of the male urethra, which can contaminate semen during ejaculation. So there's your answer. The
So it's
bacteria
almost like
may end
men
up
could have like a subclinical kind of UTI
exactly.
that could be affecting it. So if you're a female having chronic UTI issues, you have to have your partner looked at or addressed. And we'll
And
talk
so
about natural strategies. Of course, keeping sugar down is going to be one of the big ones because one of the biggest bacteria involved in UTI is going to be E. coli. So E. coli, you'll see it high in bacterial imbalances in the gut. You can also see, I think, some Pseudomonas in some, as well as some Klebsiella, but it's mostly going to be E. coli.
yeah, they were talking about E. coli and even mycoplasma in that study, which is kind of
Yep.
interesting.
Yeah, exactly. I know.
So
Yep. That's
So
a big
some
one for sure.
partners, some families or couples, they'll end up just going to using condoms because obviously that's gonna work and that's gonna prevent
Yep. Create a
the
barrier.
transfer. But really, the better thing is to get the health of your spouse improved. And so, if you're a female who's done some of the conventional strategies, let's kind of go into that now in some of the conventional stuff that's being done, and we'll compare it to the functional strategies. But if you've done some of this stuff and you're still struggling, that's when it's time to get your spouse on board. And I know you and I, we really like to work with couples, and we like to get the whole family healthier together
Yeah.
because we find that if we just focus on the female, that her results are not as good. And this actually kind of carries over into H. pylori and all the work you and I do with gut infections, because we see cases where a female will use herbs successfully to eradicate certain infections in the gut. She'll then get reinfected from the spouse, even not intimate,
Yep.
just sharing cups, spoons, drinks, kissing, and then they'll get reinfected. So as much as I can, I'm trying to bring the husband on board into these health protocols.
Yeah. So a couple of things out of the gates that men can do to help support the women is cut the sugar out of their diet, or at least drop it down to the point where you're not growing some of the microbes in the urinary tract. That's helpful. You can also add some things in, like ginger is actually very helpful. So maybe some ginger kombucha could be good, or some really strong ginger tea is wonderful. You can also add a little bit of Manuka honey because there's a lot of data on Manuka actually decreasing E. coli and staph in the urinary tract. So these are some simple kind of easy things. You could even take some raw cranberry juice. Raw cranberry juice is very high in D-mannose, which is a large sugar molecule. The body does not digest, but it creates like a magnet-like effect. It's like dragging a magnet across a surface and grabbing iron filings and pulling them out. Think of the iron filings as the E. coli. And so it kind of pulls them out. So those are some easy, simple strategies for men out of the gates is ginger, cranberry. I would say just making sure you're hydrated enough, right? Solution to pollution is dilution. Manuka and keeping the sugar down. Those are excellent strategies out of the gates.
Yep. And NAC. So we wanted to talk about NAC because NAC has been pulled from Amazon, and this nutrient is getting harder to access as just a regular consumer. Fortunately, we work with professional companies, so we still have access. We still do manufacture NAC glutathione combos, but there was a paper that we have here on NAC. And the cool thing is, I know you're taking NAC right now.
Yep.
Just
I'm taking up to 4 grams a day to help with biofilms up in the sinuses. It's also helps with decreasing virus replication in case I have any viral stuff going on. I think I have personally just a little rhinovirus. That's what I personally think. And then outside of that, increasing glutathione, antioxidant support, biofilms, helps with mucus. So it keeps the mucus kind of flowing so it doesn't impair oxygenation and blood flow.
See if you can pull up or highlight that paper I just shared on the screen there. You know, for folks listening, you're just missing out on this part of it, but that's okay. We're just trying to just show you at least maybe a couple of studies a week that kind of highlight.
And if you're listening, and if you're listening here, we'll put the video link below. So don't worry about it. Just come check it out later, and we'll put the link down below.
All right. So this is titled N-acetylcysteine protects bladder epithelial cells from bacterial invasion. I like how they call it an invasion, and displays anti-biofilm activity against urinary tract bacterial pathogens. So long story short, they discuss using antibiotics, which we can dive into that, but really that is the conventional approach for this stuff. And the problem with antibiotics in the UTI conversation is the antibiotic resistance problem. And so you'll have women that'll do these formulas, whether it's in this study, they're talking about using Cipro, which is dangerous stuff. I don't like the sound of Cipro at all for many of the, potential permanent tendon issues and other side effects associated with it.
Yeah, Cipro is in the fluoroquinolone family, which can negatively impact mitochondria and connective tissue. So if you're going to use a antibiotic, try to use one not in the fluoroquinolone family, maybe amoxicillin or tetracycline. Just talk to your MD if you're going to go that route to avoid that antibiotic at least.
Yeah, but here's a conclusion. NAC is a non-toxic anti-biofilm agent and can prevent cell invasion, formation by uropathogens. So once again, NAC for the win. Stuff's incredible.
Yep. And again, with antibiotics, like I'm always about, let's do the more natural things first and kind of go least invasive to more invasive, right? And antibiotics would be the top part of the more invasive side.
This is interesting. I guess this was an Australian researcher or doctor who put this study together. They're saying here that in Australia, there's an estimated 150 million infections, and that this is 12% of hospitalizations.
UTIs are?
For UTIs.
Wow. Yeah. Holy smokes.
And 30% of all women have a recurrent episode of UTI. And then, of course, the problem with the UTI, right? UTI kind of sounds like, oh, it's not too bad. But I mean, when this stuff gets up and infects your bladder, that gets really bad. And then it can even further ascend and then infect your kidneys. And then that's when you get into really big trouble. And that's where they talk about sepsis and some of these other literally potentially fatal infections from UTI. So when UTI is kind of one of those, it sounds like it's just like this easy, not a big deal, but it could turn into a big deal.
Yeah. So just kind of like out of the gates, like what are the symptoms of UTIs, right? Obviously like pain during urination. You can see a lot of cloudiness in the urine, right? Potentially even blood in the urine. It can have a really strong smell as well. It could even create pelvic pain in that area, that pelvic or pubic area for sure. It can also move up. So women have a very short urethra, unlike men. So that urinary tract can go to the bladder very, very easy just because the distance is really short. So once it goes to the bladder, right, you'll see pelvic pressure. You may see blood in the urine, frequent painful urination, lower abdominal discomfort. And then, of course, it can continue going up from there into the kidneys. And that's where you'll start noticing a lot of back pain, flank pain. You may notice starting to get chills and fever and maybe nausea and vomiting. And usually once it starts to get into the bladder and the kidneys, you may want to look at seeing conventional medicine for an antibiotic at that point. definitely in the kidneys. But I mean, I think if people can be educated about this and be on top of it, I think you can avoid a lot of that upstage conventional need for medications.
Well, like many other things that we've talked about, early treatment is key. So if you can come in and hit some of this stuff hard with D-mannose, your N-acetylcysteine, we use these cranberry extracts very effectively. You and I've also used some professional formulas that contain hibiscus and parsley and horsetail. So the goal really, I think, is to try to break this down into like three main categories. So you've got the biofilm breaking components like your NAC, for example,
Yep.
or you could add in like nattoserozyme or some sort of other proteolytic systemic type enzymes. Maybe even lumbrokinase would help. So that's your number one, is your biofilm busting. Number two, you've got your antimicrobials that you and I use, like bearberry, barberry, maybe even clove or oregano might be helpful. Silver, I think, is worth a mention. And then I would say the third mechanism of action is the anti-adhesive properties. So you're really trying to help flush things out. So that's where just hydration comes in
Yep.
handy.
Mannose.
And some of these herbs.
Mannose too.
Yeah, mannose
Because
is
that's
like
gonna
your
pull. That's gonna help pull the E. coli off, like iron filings, right? Like I gave that onto the gates.
mhm.
So just a couple of foundational things. We're kind of hitting some of the meat here. I want to just kind of make sure we set a good foundation. So out of the gates, women are going to be more prone because of a couple of reasons. Okay, number one, we talked about the intercourse and the injection of semen that may either have bugs in it or it may just essentially expose a weaker urinary tract. So of course, the first thing is hydration if you're a female, and getting up after sex, getting vertical and going to the bathroom. Get that urinary tract moving, get some hydration in you. That's a really good first strategy out of the gates. And of course, if you're prone to having UTIs, you may want to have a little bit of powder D-mannose, like we mentioned, or some of the formulas that Evan mentioned, some D-mannose, uva ursi, parsley is excellent, maybe a little bit of silver, but you can just start with a little bit of D-mannose, a little bit of cranberry extract, and a little water, and drink that before bed or, after a interaction like that. The next thing is you can look at the hormones, right? Hormones can play a big role. So you have the high and you have the low. So women that have very high levels of estrogen, especially women that are on birth control pills, that's going to shift the urinary tract pH based on the high levels of hormones, and that can make it easier for the E. coli to grow, because E. coli does not like an acidic environment. And if you start to make the environment more alkaline, right, you usually hear alkalize or die. Well, not necessarily. The urinary tract, if it's alkaline, can actually grow bugs. So birth control pills can actually cause the bugs to grow due to the alkalinity. You can also see it the opposite, right? It's like the Goldilocks effect. When women go into menopause and their hormones drop, low hormones can also have an impact on the immune system in the urinary tract, and that can cause you can be more prone to having UTIs if you're menopausal with low progesterone, low estrogen, because that plays a role in the environment and the immune system and the IgA levels in the urinary tract. And so not too hot, not too cold, right? Not too much hormones, not too low hormones. So birth control pill on one side, too much. Menopausal issues, low hormones on the other side. You really need to work with a good functional medicine person to get the hormones dialed in. It may not be a simple, hey, take this supplement. You may have to fix the hormones too.
Yeah, good call. Good point bringing that up. And that's more of like a longer term thing. That's like if you're trying to get well and stay well, that's the
Yes.
stuff you're going to be looking at. So is it possible to come in and use some calcium D-glucarate or something like that to help that pathway and get rid of the excess estrogen? I think it could help, but is it going to like acutely get you out of the UTI? Maybe not. So I think it's good, like you're mentioning, to have a plan, meaning like a long-term health, functional medicine health plan that then prevents you from having to do some of these acute strategies we're talking about.
Yeah, I mean, there's palliative kind of non-root cause support that we have, but we try to always package in the palliative stuff with lifestyle changes that make it more holistic and make it more root cause. And then we also dive into the hormonal aspect. And also, I would even say gut aspect. I've seen imbalances in the gut bacteria shift and influence the urinary tract microbial balance too. So microbial imbalance in the gut has a way of shifting microbial imbalance in the urinary tract. And it could be just 80% of the immune systems in the gut, and that's having a major effect. Could just be some of the stuff's working its way down there just through moving through the intestinal tract. It has a way of shifting or migrating or moving in some way, those kind of things. But either way, look at the gut. That's where a lot of the immune system is. Look at the hormones. Look at medications that could be influencing these things. Look at hydration. Those are kind of the root, I think, starting situations you really want to have your head wrapped around.
Yeah, in regards to testing, you can do this at home. They have companies that make at-home UTI test strips that you can do where you just urinate on the strip and you're going to be able to test your leukocytes. And they have a little reference range that you can look at. And basically, on most of these, it's purple. The darker the purple, the more severe the infection is. And we had incredible results with our daughter using some of the D-Manos. We have some chewable versions. We did some of these herbs mixed in with some applesauce, and we retested using these little pea strips. And I want to say I'd have to ask my wife to confirm. It was either 2 or 3 days. We completely got it from a deep dark purple, indicating a very intense UTI, to nothing. It was completely white. So the brand is called Azo, AZO, and they also make other things. I think they make like ovulation strips and that kind of stuff for more like female health. But this urinary test strip, you're looking at maybe $10 for a pack of these. So if you do have suspicion or if you've had chronic UTIs, this is something that I would recommend you do at home, because so many times you and I hear the story of the woman having to schedule an appointment, get into the doctor. Yep, I have a UTI. It's like you could have done that and figured it out at home in 2 minutes for $10. The accuracy is very, very good.
Absolutely, 100%. And of course, there's some tests. If you do like a uroscopic or a microscopic urinalysis, we'll be looking at leukocytes. We'll be looking at protein in the urine. We'll be looking at pH. We'll be looking at potentially bacteria, E. coli, looking at the actual microbes in the urine. That's helpful. And then obviously just from a diet, just from a lifestyle strategy, this is obviously going to pertain more to kids, right? Just teaching your kids how to wipe the right way, right? Females, front to back, kind of common sense, but kids obviously develop bad habits, and that can be a simple, easy lifestyle methodology that can fix that problem. And just getting more water, more hydration. If kids have a compromised immune system due to too much sweets, obviously artificial sweeteners like aspartame, Splenda, those can impact the microbes as well. Those things can compromise the immune system and shift the microbiome kind of balance, microbiota balance in the gut and in the urinary tract.
Yep. Let me show this one more thing. Do you mind bringing this, highlighting this paper
Yeah,
here?
absolutely.
There's one more that we wanted to show people. This was just titled Perspective Study to compare, they said antibiosis. They're talking about antibiotics versus NAC, mannose, and morinda fruit. And the conclusion of the study at the bottom here, mannose and NAC resulted in similar to antibiotic therapy. So even if somebody wants to nitpick and argue, well, antibiotics are like better, they're not. They're not. Now, I'm not saying that in a severe situation where your kidneys are affected and you're going septic, I'm not saying I'm going to try to do this, but I'd be doing all of it. I'd be doing the mannose, the NAC, maybe the antibiotic if I had to. But I mean, based on the stuff you and I've seen clinically, based on more than what we've looked at in these papers alone. I mean, the cool thing about PubMed too is you'll be able to have related articles pull up. Like you could go into this one, D-Mannose and hibiscus and lactobacillus and probiotics,
Yeah, probiotics are going to have a major influence as well due to the acidification of that area. I mean, you can depending on where you're at, you could potentially even do intravaginal probiotics. You could put the capsule in, let it dissolve, or you can mix it in with like a little bit of aloe or shea butter or coconut oil, something that's going to dissolve. And you could essentially mix it in, freeze the cube or refrigerate the cube so it's solid, and then insert intravaginally, and that will kind of dissolve, and then it will contain some of those nutrients to help support the vaginal canal. And depending on where you're at, if there's some yeast, you could even do that same thing with boric acid too. I recommend some kind of a carrier though, just so it's not as abrasive if that canal or that tissue is really sore or irritated. It just provides some moisture to that area as well and won't irritate it. And if you're unsure, test the moisturizer, whether it's aloe or shea butter or coconut oil. Test it before you put any of the extra stuff in it so you know if that's a problem at all.
You know what I've also seen to be beneficial? I've seen some homeopathic vaginal suppositories for UTIs. I don't know much about them, but I've had women try them and they have worked when everything else failed. So I think you should be open to it. And the probiotics are a game changer too. As you mentioned, you could do intravaginal with the capsule. It'll just dissolve, or just oral probiotics has been helpful. So as you mentioned, the gut, that's something we're going to look at. So if we see a female who suffered with UTIs and we see she's got a lot of issues on her stool test, we can't say directly, hey, this is why you have UTIs. But if we fix the stuff in the gut, chances are high that they're going to suffer less and less frequently from UTIs. It's really, really important. As you mentioned, you got this vaginal microbiome, you've got the oral, you've got the gut, you've got the skin microbiome. So, I mean, if anywhere there's dysfunction or dysbiosis going on, I think they could affect the whole system.
Absolutely. And then men play a part of the role, in this whole thing. So get the sugar consumption down, better hydration. Could always throw in a little bit of ginger or cranberry kombucha. That's a really easy, simple thing just to add in as a routine. Sometimes it's easier to add things to a routine than pull things out.
Well, think about how many men you and I've seen and work with over the years with gut issues. So, I mean, getting their gut straightened out too is going to be my goal, because I'm sure that's going to affect what we're seeing in these papers on like semen quality, and they're not passing these microbes, via sperm. So, men, you got to get on board. Women just, I feel bad for them because they take a lot of the blame. They take it upon themselves, like there's something wrong with them. And in many cases, there definitely are issues with the dysbiosis in the female, but in the men, they kind of get off the hook, So we're calling all the men out here. You got to get involved too. You got to get your health involved. If you're over there eating pizza while your wife is sitting here cooking a paleo meal, you got to get on board, because this is a team sport here.
Yeah, and then you can always use a barrier method if not, right? That's an easy way, at least in the interim. And then also just getting the hydration up and avoiding the sugar can make just a huge difference. Sometimes it's not even 100%, just an 80-20 can make a huge difference on that.
I know how men are, being a man. So if the wife says, honey, you're going to have to use condoms for the rest of our sex life, I think that'll be a easy, quick motivator to get them on board and
Totally.
do other natural.
Yeah, I find like kind of in the manosphere, there's like two kinds of men. There's like the men that are like biohackers that are like always into like optimal performance, trying to improve and get everything kind of optimized in their health and their life. And there come some guys that they kind of they're a little bit more slow to the punch, and they're motivated by what the rest of their family's doing, their wife's doing, and then their wives kind of get them on board. There's like kind of like two classes like that. I think me and you tend to be more in the biohacker class. And we see a lot of biohackers that are in, right? That are really motivated, and they're all about performance. And then some, their wives are more on that side of the fence, and the wives kind of get them motivated. But most of the time though, once someone can see their life improve, and usually if you get healthier, you don't just improve in the urinary tract, you improve in cognitive, mood, libido, energy, digestion. So women, if you can get your husbands on board, they're going to see a lot of buy-in, hopefully other areas, and hopefully you'll be able to get them a long-lasting buy-in, which is really important for energy and just, people being healthier, which is important.
Yeah, well said. We can mention this comment here that came in the live chat, and then we can wrap it up. We've kind of hinted at this, but we didn't say it directly. When we talk about UTIs, I mean, a lot of times we are referring to the bacteria, but in many cases, there's a yeast component too. So there is a fungal component. Here's the cool thing though. You and I are always using blends, and these blends are not only antimicrobial, but also antifungal, anti-yeast. So someone in the comments here wrote that they kept getting UTIs even after getting treated until they started yeast treatment. And that's the cool thing. Think about if you come in with antibiotics. Let's just quickly compare the conventional and functional approach. You come in and do the antibiotics. Those are not antifungals. But if we're using something like bearberry, barberry, berberine, clove, silver, Saccharomyces boulardii, probiotics, we're creating an antifungal, antimicrobial, antiparasitic protocol all in one, which is awesome because sometimes we're killing multiple birds with the same stones. And that's why we love what we do.
100%. And of course, a good history will kind of figure this out based on, if you have a new sexual partner or not. STDs always can be a thing. So we're looking at chlamydia, maybe gonorrhea, right? And so these type of infections, I think we could probably see some improvement with some of the natural things, especially if we add in silver and such. But these type of things, if you're not having results, they may require a special kind of antibiotic if that's at play. And so obviously, it's going to be history dependent. If you're in a steady relationship, then that may not be a thing. Or if you're not sexually active, that probably isn't going to be a thing. But it's always good to kind of keep that in the back of your differential list of things that you kind of work up through from least likely to most likely.
Yeah, good call. So on that NAC paper, it actually did talk about chlamydia, and it talked about the mycoplasma, and there was a couple others in there, and it was talking about the anti-adhesive, anti-biofilm properties of the NAC. So even if it were an STD, I think NAC is something you'd still want to implement.
Yeah, I mean, usually you're going to see some level of discharge too with some of the STD stuff. But worst case, you can just get it tested, try some of the simple things out of the gates. A lot of times the history will tell you, especially if you're had intercourse and then the next day, with your husband or partner, and the next day you're starting to feel some issues, then it's probably going to be on the E. coli side of the fence, which is 90% of the time. That's 90%. So, if you have 90% odds with something, we're going to go with that out of the gates for sure.
Yeah. Okay. So testing strategies, just to summarize, you could do the at-home test strips for this. We think a good stool test would be in order to figure out what's going on with your gut and how that's affecting your microbes down south. Same with your partner. If we can get them on board, get your stool looked at. A urine test is helpful too, because we're going to be able to look at candida overgrowth and other types of fungal colonization. So we like the organic
Yep.
acid. So an oat, a stool, and then some of the at-home test strips. I think that would be a great starting place. Could you do other things, blood work, and as you mentioned, like the urinalysis, and like in the conventional lab, you could do that too, but you might not if you do these top three.
Absolutely. And then the big symptoms that would differentiate an STD over a UTI are going to be like more systemic symptoms. So like nausea, fever, swollen joints, sore throat, symptoms that are kind of have gone more systemic. And of course, there can be some localized symptoms that can be more severe, like extreme discharge, severe rash in that area, blisters in the general area. But look for more systemic type of symptoms that could be driving that.
Okay, you're saying more systemic symptoms would be what?
The ones I just mentioned. So pelvic.
No, would be a UTI.
No,
as opposed
that's
to
going to
an
be more of an
STD?
STD. So think of STDs are more severe, therefore the symptoms are more severe. They're more systemic. So think of
Okay,
systemic
got it.
symptoms of things that are more severe, localized symptoms, right? That means the microbes haven't spread as much and they're less severe. So more severe, think of the STDs.
Got it. And then you mentioned in the beginning, if the UTI is more severe, that's where the back gets involved. In the case of the kidneys, there are people that they perish due to UTIs if you did go septic. So obviously you would have a lot more issues then. You would know by then. You'd be in real bad pain.
Absolutely. Yep. 100%. And again, like, a UTI unaddressed can go to the bladder and then the kidneys, and then you could have a fever. You could have these things. So as a
Mhm.
UTI gets more severe, that could definitely drive the symptoms up as well. But usually people can see it because it's just following that urinary tract. It's going from the
Mhm.
urinary tract to the bladder to the ureters and then up to the kidneys. So yeah, usually you can see that and feel it. The pain starts to move up.
Cool.
Well, anything
Well,
else
we
you want to
work
add?
with this issue. No, I mean, I was just going to say we work with this issue all the time. We're really happy to help people and to provide solutions to what have been a major issue, a pain, an issue, and like I said, with people's sex life and with just people's personal health. I mean, this is something that's a big burden for a lot of people, especially women. So we're really happy and fortunate to have outside of the box tools that we use with great success. And we don't only back that up with clinical experience, we backed it up with some of the research we've dove into, and the professional formulas we use are tried and true. So if you need help, please reach out. We would love to help you. If you want to reach out to Dr. J, you can at justinhealth.com. Justin Health. If you want to reach out to me, Evan Brand, you can do so at evanbrand.com. And we both work worldwide via FaceTime, phone, Skype, and we send products to your door. So if we need to get any of these labs done, investigate you, it doesn't matter if you're in California or Oregon or Michigan or Florida or New Mexico or Australia or Canada or Europe, we can do it. We can help. And we work with people around the world, and we have for decades. So it's just a true pleasure to get the hands-on experience with this issue, because I think the most empowering thing is to know that you're not a victim, meaning you're not just going to have to go on antibiotics. That's just the foghorn of the conventional approach. And it's just so empowering and inspiring to know there's other ways, there's other tools, there's other approaches that are very successful.
100%. Yeah. And if you guys enjoyed it, evanbrand.com, justinhealth.com, there'll be links right there to work with us. Hit that thumbs up, helps the search algorithm improve so more people can see our information, and give us a share, give us a comment, write us a review. We'll put links below to do that. Thanks, y'all. You guys have a great day. We'll talk soon.
Take care.
Bye, Evan.
Bye-bye.